189 patients of a Macon surgery center received spinal taps that were contaminated with fungal meningitis. This same batch of steroids has claimed several lives across the U.S., but so far no cases have been reported in Georgia. We spoke with local health officials who say there's no need to panic because the disease is treatable. North Central Health District Director Dr. David Harvey says there's no need to point the finger at anyone for injecting 189 patients with a bad batch of steroids used to treat back pain.
This is a tragic mistake, and we hope it isn't tragic, but it has the potential to be so.
The Forsyth Street Ambulatory Surgery Center received a lot of steroid medication prepared by the New England Compounding Center. It was contaminated with fungal meningitis. Forsyth Street orthopedic surgeon Dr. Charles Richardson says they've been working to notify all of the at-risk patients.
We've called all the patients dating back to July to be sure that they haven't had any symptoms similar to the ones described over the news and press.
Dr. Harvey says 160 patients have been notified. They're still working to speak with 29, and 6 have been referred to physicians after complaining of mild meningitis symptoms. But the disease isn't contagious, and if caught early, it's completely treatable.
We don't want the public to be panicky, but we want the people who are at risk. And again, as we said, try to say clearly, it's a limited number of people who got a limited type of treatment in one facility.
And Dr. Richardson says there's no need to fear the facility or the disease.
We have no reason to believe that any of our patients are going to be sick.
The tainted medicine has claimed 5 lives in the U.S. 43 cases have been identified. Now, we'll of course keep you updated if there are any reports in our area, but again, this disease is not infectious. And if you don't know what meningitis is, here are some facts. According to the Centers of Disease Control, there are 5 types of meningitis: viral, bacterial, parasitic, non-infectious, and the type in this outbreak, fungal. Fungal meningitis is rare and can be treated, but can also be fatal. Signs and symptoms include nausea, vomiting, photophobia, which is sensitivity to light, and changes in your personality. Treatment for fungal meningitis includes a long round of antibiotics, typically given in a hospital through an IV. If you think you've been infected, go to the doctor right away.